Hi, this is Sandra with another XDR Clinical Minute. This is part 5 of our series on the XDR holder kit. And in this video, I'll be demonstrating how to assemble a sensor holder for a posterior PA. In front of me, I have two bite pieces, a size 1 and a size 2. Both bite pieces are for a posterior PA. And today I'm going to be assembling a size 2 sensor holder, since that is the most commonly used size sensor. Everything I'm going to show you in this video can also be done with a size 1. You just have to use the black bite pieces. But for now, we'll put that aside and we're just going to be working with the size 2. To put together the size 2 sensor holder, you're going to take your sensor, and of course you'll have a barrier on the sensor, and I like to pull the plastic back so I don't have a lot of excess plastic hanging off the sensor there. You're going to take your bite block and you're going to snap the sensor in. You don't want to slide it in because then you'll end up tearing your bag there. So we just snap one side in, snap the other side in. Make sure you check that the bite piece is centered on the sensor there. And if you're going to be using the paralleling guide system, you want to find the aiming rod that has the word posterior on it. And that's the one for posterior PAs. So what you'll do is you're going to take the pegs on this rod here, and you're going to place them into the holes on your bite piece. Now when you position these two together, you want to make sure that your rod, the direction of the rod, the arm, is coming out the same direction as your cable. So that's one tip to know that you're assembling it correctly. So the cable and the rod need to go in the same direction. Once you have those two together, then you're going to take your ring, and your ring is labeled also. One end has BW-ANT, the other end has the letter P on it. And we want the P end for posterior PA. And you're going to take your rod, place the rod into the P end of the ring. You have a little clip here for your cable, so you can place your cable in there also if you like to. And then as long as your sensor is centered within the ring, then you know you've put together the size 2 sensor holder correctly. And now you're ready to take size 2 x-rays with your paralleling guide system. Okay, and you can use this same bite piece and sensor with your H-stick guide system. And to do that, what you'll do is, if you want to use this similar to a snap array, then you're going to use this stick, which is called the H1 stick. And you can place the bite piece on either side, whatever is convenient for you. And you just place the bite piece onto the pegs like so, and you can use it in this position, very similar to a snap array. If you want to use a ring and a rod, you can do that. You place this peg into here, this little hole there on your H1 stick, position the ring so that you can see the sensor through the ring there. And this is assembled for taking size 2 posterior PA x-rays with a ring and rod using your H1 stick. But if you're going to be using this to take a full FMX, you can use the H2 stick, which is the shorter stick here, and this is labeled. One end has the letters PA on it, the other end has the letters BW. We want the PA end. So we take our bite piece again, and we're going to place these pegs into the little holes here, and you can use it again just like this. But if you want to use a ring and a rod, you can take your rod, you're going to place it into the hole on the H2 stick, and then you'll take your ring, and again you're going to position it to where you see the sensor is centered within the ring. You have a little area here for your cable, and as long as your sensor is centered within the ring, then you're good to go for taking size 2 posterior PAs using your H-stick guide system with the H2 stick. Now everything you've seen here can also be done with a size 1. I have one assembled here. So this is a size 1 sensor using the paralleling guide system. And again, as long as you can see the sensor centered within the ring, then you can take size 1 posterior PAs using your paralleling guide system. So that is how you put together the size 2 posterior PA sensor holder. For more information on the holders and how to assemble them, please call the XDR number and ask for a clinician, and they'll be happy to help you. Thank you for watching part 5 of our series on the XDR holder kit, and we'll see you in the next Clinical Minute.